How soon should you start learning about Medicare, the different choices, and which one makes the most sense for you? And then when should you enroll? When do you actually sign up? We've got that question and more coming up. Welcome to a bonus episode of the Wise Money Show, where we're spotlighting a question from a fan of the show and topic that all is designed to help you take your next wise step in your financial life. Today, back in the studio, welcoming Ben Bulgrien, health insurance expert, along with me. I'm your host, Mike Bernard, and tackling a question that I think is fairly common throughout your career. You know, at some point, you're going to be transitioning from your workplace retirement or maybe an individual health policy through healthcare.gov onto Medicare. What's that process look like? When do you get started? What are the A's and B's and all of that with Medicare so that you can make a great choice? Ben Bulgrien has been a regular here on the Wise Money Show. He's also one of the health insurance experts at Korhorn Financial Group. Welcome back in the studio, Ben.
Thanks, Mike. Good to be here.
All right, Ben, we're going to start with a hot take and just curious, what's the state of Medicare? Like where do we stand? It just feels like it's broken, and yet I don't hear a lot of talk about reform or really any good ideas at all. Yeah. So like, what's your sense? Is the state like solid or is it volatile? Where are we?
Leaning more towards a volatile. I would say we're in a testing period. So new for 2026, Medicare has introduced something called the Wiser model. Fans of the show, you know, maybe sounds like a pretty good thing.
I don't know if I want to be associated. Okay.
So it's the wasteful and inappropriate service reduction model. It is Medicare trying to identify areas where there has been significant fraud, waste, and abuse within the system so they can start doing prior authorizations for those policies. So right now on Medicare as a whole, original Medicare, there really isn't a lot of prior authorization where you need permission to get something done, approved by Medicare before your doctor can do this. They're piloting this program. It's for a handful of services in a handful of states to hopefully reduce the amount of fraud, waste, and abuse that's happening. So an example that I've heard, there is a skin grafting procedure that is happening in Arizona that I believe was last year alone cost to the tune of $1 billion.
Oh, wow.
And so it is for services that are proven to be ineffective or not very likely to be effective. And they're trying to introduce a little bit of friction to prevent people just saying, I'm going to submit this to Medicare and we're going to get, it's the bad actors, but the bad actors are going to lead to potentially some additional hurdles for individuals that are on Medicare as a whole. So they're piloting this program, trying to get a feel for what that might look like for Medicare as a whole. Medicare Advantage plans have had that for a long time now. So they have had all of these checks and balances in place to try to prevent this fraud, but that then leads to maybe a little bit more hoops to jump through for the consumer.
Yeah. Okay. Do those hoops to jump through create more cost as well? Like you'd hate to say, well, hey, we're going to try and in an effort to reduce cost, we're going to add some other layers, which actually create cost as well.
So a byproduct of that, I would say, is potentially related to that, potentially related to just rising healthcare costs in general. The testing period that we're starting to see for Advantage plans is companies choosing to no longer pay commissions to agents.
Oh, yeah. Right.
Prescription drug plans are the same this year. No prescription drug plans are commissionable. And what that translates to is it's going to be challenging to find a professional that will give you an unbiased assessment of what's best for your needs.
Yeah. Gosh.
So those Advantage plans, as fewer plans pay commissions, that means that agents that are commission-based or are captive to a certain company are going to have fewer options to provide as places where a person could get their insurance from. And it might not be in the best needs for that individual.
Okay, and then and we need to move on here. But what most folks don't already know is that the Medicare service providers are already heavily regulated because of the the experience of many charlatans trying to take advantage of folks in this position. Right. And so this, not paying commissions is probably going to make that worse.
Probably.
Right?
Yeah.
Oh my goodness.
But they're testing like that. Yeah. That's what it feels like. Hey, we're going to do this with this plan. can we do this with these other plans in 2027 and these other plans in 2028? What's the impact to the consumer going to be? So that's why it feels like it's a testing period right now.
Yeah. Okay. Well, we want to help you be aware of how Medicare works and what the process is for you to transition on to Medicare at 65. Most people are eligible at 65. There's a few circumstances where you might be eligible sooner, but most people 65, so that you're maybe not caught off guard, or maybe you can avoid some aggressive sales tactics or someone telling you something that you really don't need. But Medicare is wildly complicated, Ben. So before we get into the process, just lay the foundation.
Yeah.
Parts, plans, one word, Medicare, actually means a couple of different things. Right. So give us the lay of the land with Medicare.
Yeah. So we've already talked about Advantage plans. So we're gonna take a step back from there. The foundation for whether you would choose an Advantage plan or just go with traditional Medicare would be Medicare Part A and Medicare Part B. So A is hospitalization, B is medical or doctor visits. A is going to be premium free for most individuals because you've been paying for it through FICA taxes as you've been working. B is going to come with a premium. It's going to be based on your income. And to make it easy on us, they do it based on your income from 2 years ago. It makes a lot of sense if you don't think about it.
Yeah.
So A and B is the foundation regardless of what path you would choose. One of those paths would involve adding on a prescription drug plan, Part D for drugs, only letter in the entire thing that makes any kind of sense. And then our recommendation, if you were to stay on traditional Medicare with a prescription drug plan, would be to add a Medicare supplement. Those ones are lettered too. There are 10 of them. And to make things simple, we focus on one, and it's the most popular one is Plan G.
And it's not because of any other reason other than it's most comprehensive. And
right.
Most people like it. So original Medicare, or I call it traditional Medicare, Part A, B, D, and a supplement.
Right.
A typically is no premium. B, that premium right now is what, $202.90?
Yep. Right.
Per person per month, but it could be higher if your income from a couple years ago was above certain thresholds. That's where IRMA comes in, income-related monthly adjustment amount. Part D is prescription drug. That cost varies.
Right. Yeah.
And also there's some IRMA that could be applied there as well. And then a supplement. $200 a month, $175.
Yeah, our ballpark there.
Yeah. All right. So that's traditional Medicare.
Yep.
And then contrast that with the other side, the other question.
Yep.
Or
so
the other
Advantage plans, also known as Part C. So those are also known as Medicare replacement plans. This is going to look more similar to an employer-based plan that you've had previously. So on Medicare, we talked about it towards the beginning. If you want to get something done, you can pretty much get it done. As of today, if it's covered by Medicare, there's no hoops to jump through. With a private insurance company, Part C is going to be, well, you need to make sure you get prior authorization for those services, just like an employer plan. There's going to be co-pays as you would go to the doctor, $40 for a specialist, $0 for a primary care physician. You're going to have a max out of pocket for the year. Most of the Part C plans do include drug coverage, but not all of them. So we would want to make sure that unless you had a place to get prescription drug coverage elsewhere, like through the VA or something, that we would have that bundled within the plan that we'd select.
And then you don't need a supplement plan because the Medicare Advantage basically is designed to kind of connect the your Medicare and private insurance.
Yep, the all-in-one bundle. And this is one where doctors are going to be really important. So you'd want to make sure that you list out all the doctors that you want to make sure that you can see any specialists that you are going to for ongoing treatments, and then prescriptions as well. Advantage plans are going to come with some additional benefits. Dental, vision, hearing, silver sneakers, like a gym membership, something along those lines. That is the cherry on top, because ultimately we're making a medical decision and we want to make the best medical decision that we can. But it can be attractive on its face value, and that's the thing that all those advertisements are going to say, look at all these benefits that you can get. And that's not to say that it's not worth it, but it's a really, really small piece when we're talking through what healthcare decision you're making.
Okay, the last time you were in the studio, there was a question where the individual also said, hey, I'm going to be spending some time in a different state or in a warmer climate. Medicare, like original Medicare, traditional Medicare, or Medicare Advantage, are both of them okay for snowbirds? Or, I mean, is there anything to consider there?
Original Medicare is gonna be a little bit easier, because as long as a provider would bill Medicare, which 97% of the providers in the United States do, then you can go and see them. No questions asked. On an Advantage plan, it's back to network-based care. So it's going to be dependent on being within that plan's network. Most of the Advantage plans, at least at this point, are PPOs. And so you do have some additional flexibility that wouldn't be present on a marketplace plan.
Yep.
And some of them are even moving towards open network PPOs, which means if a provider bills Medicare, you can still go see them. However, it is dependent on that provider being willing to work with that insurance company. And that can get into some sticky situations as well. So it's original Medicare is going to be easier. It's just, does that trade off of the higher monthly cost for their specific health needs? Does that make the most sense?
Got it. You got to be working with your CFP, looking at your retirement plan to see what you have built in. You've got to then have that CFP collaborating with your health insurance expert to evaluate these options. Curious for you, are you planning on going traditional Medicare, or do you know, Nate, I'm planning on Medicare Advantage? Leave comments below. All right, let's get into this fairly innocent question, but I think it's a very common one.
Yeah.
And so here's the question. I'm turning 63. I'm starting to wonder about Medicare. When do I need to sign up? And that's it. That's the question. But Ben, let's kind of answer all of the question there. And that is, well, what's the process to start learning?
Right.
How do I know about these choices and how they impact me?
Right.
When should I start meeting with an expert? When do I sign up? When does that insurance take effect? Yeah, kind of go through the process.
Yeah. And this is like I had mentioned last time, this is the most common question that I get is when do I need to do this? So I'm gonna start with when should I meet with somebody? What I tell people is whenever you want to, because this is the biggest healthcare decision ultimately that you're gonna make in your entire life. And so my hope is that we make sure that you feel as comfortable as possible moving into it. So if this listener wanted to meet with me at age 63, I'd happily do it. We can't do anything yet.
Yeah.
So we are outside of the window. For most people, the time to sign up for Medicare is within a 7-month window around your 65th birth month. 3 months before, 3 months after, and your 65th birth month. I say most people, however, some individuals would have employer-based coverage that's through a qualifying health plan that would not need to sign up at that point. They could delay signing up as long as they were covered by that plan, either through their work or through a spouse's work, and they could wait until they're 70 and not face any penalties. So timing-wise for that one would be probably 64 and a half, somewhere around there, so we could get a lay of the land, an idea of what the situation is, and then we can talk through, well, if you are signing up for Medicare, how do you do it? And the easiest way for most people is going to be going to not Medicare.gov, because that would make a little bit too much sense.
Yeah.
Somebody decided that it made more sense to go to SSA.gov.
Oh my goodness.
So SSA.gov, there's a Medicare drop down in the navigation bar at the top, and then you can click on the sign up for Medicare. You're going to sign up for Part A and Part B. For most people, again, unless you had a specific situation that allowed you to delay signing up without getting penalized down the line. So that's the easiest way. You can also call the Social Security office, or you can go to your local branch. The tricky part with that is if you stop in, they might say, thanks for stopping in. Here's a time that we're going to give you a call in 3 weeks from now. So just be mindful of that, whatever's going to work the best for you. When you would sign up, it's going to take 4 to 6 weeks or so to process that application and get you your red, white, and blue Medicare card in the mail. And that's the piece that we would need to enroll in your either supplement and prescription drug plan or your Medicare Advantage plan. So our recommendation would be if you're turning 65, you don't have a group health plan, to get started on that towards the earlier end of that spectrum, so 3 months before your 65th birth month, to make sure that we have enough time for that to process. Us get our card, have your plan in place, so it began on the first of your 65th birth month.
Okay, so this is very complicated. Is it typical that someone would start the process and start meeting with you at 64 and a half, and in one meeting of reviewing and explaining how this works, there's an epiphany, there's clarity, there's confidence, they can make a decision? Or would you say, nah, it's more common, maybe let's talk at 60, like around 64, and then come back in at, 64 and a half, something like that. Is that more common, or what do you think?
I'd say it's more common for us to around 64 and a half to have that initial meeting where we go through, here's a supplement, here's an Advantage plan, here are the trade-offs involved in each of them, and to not leave that meeting with a 100% answer.
I got it. Okay.
I would say, and I try to stress that, hey, this is a lot of information. It's complicated. The good news is we're not making the decision today. We can't do anything until we have that red, white, and blue Medicare card.
Yeah.
So go home, talk with your friends, talk with your family. Keep in mind that their situation is different than yours.
Yeah.
So it doesn't mean that what works for them will work for you, but we're gonna get the knowledge, we're gonna get the foundation, we're gonna start the conversation around 64 and a half, and then when we meet again, we would, once the card is in, we would enroll, and then any time between the first meeting and when we meet to enroll, I say, hey, schedule another meeting. If you've got questions, give me a phone call, send me an email, because it's a lot. It's a whole lot.
Okay, so 64 and a half, you're applying for Medicare, and then it takes 4 weeks or so to get your red, white, and blue card. Let's say then that next meeting is 2 months later, so now you're 3 months before your birthday. And then at that time, you pick your lane, you go for it. When does coverage start? When does Medicare start?
For most people, it's going to start on the first of their 65th birth month.
Okay, so you turn 65 on the 15th.
That's the first.
It's the first. It's not the next month.
It's not the next month. The only real exception to that rule is if your birthday is on the first, it starts the first of the previous month.
I'm asking that question for our listening audience. However, you've explained that to me maybe a half dozen times, and for whatever reason, it does not stick in my brain. So, yeah, very complicated. Anything else that you'd share about the process for signing up for Medicare?
It's going to feel like a lot, and all those advertisements don't help. What I would say is work with somebody that you trust.
Yep.
Because it's a big decision, and some piece of that is if you sign up for an Advantage plan because you're drawn to the benefits, one thing to keep in mind, there's a 1-year trial period with those plans. Within that year, if you decide, well, the network isn't as robust as I thought it would be, I'm paying more out of pocket than I was expecting, you can switch to a Medicare supplement without any risk-free. But outside of that 1-year trial period, you would need to pass medical underwriting in order to switch to a supplement. Not saying that to try to scare people away from Advantage plans. I think it works for a whole lot of people, not for everybody, but just something to be mindful of. If you're talking with somebody that's only talking about Advantage plans, or you're only talking to somebody that only talks about supplement plans, then you're maybe not getting the full trade-offs that are involved in either side.
Yeah. Well said. Thank you, Ben. To me, I would just double click on, listen, this is one of the biggest health insurance decisions that you're going to make in your life. And it's got to be integrated with your cash flow, with your retirement plan, with even your investments and your withdrawal strategy, your tax planning as well, because of how the Medicare Part B, especially, but also D, is based on that income. You've got to look at all 6 areas of your financial life, but even more so, you've got to be working with a health insurance expert, someone who is an expert in knowing all of the options and isn't just trying to steer you into one over the other options, but to educate you and help guide you to make the best decision for your financial life. Work with your certified financial planner on that. If you don't have a CFP on your team, you can contact one on our team. Find us online, Korhorn.com. That's Korhorn with a K. WiseMoneyShow.com. You can find us there as well, or give us a call, 574-247-5898. All right, there you have it. Go out and take your next wise step in your financial life.